I would say one of our biggest topics, either on the phone or at appointments, would be talking about birth control pills and how they affect your body and what's normal.
And I think that's a very important subject because birth control pills is the primary method of contraception for young women. And I think it's important to understand them and to take them correctly, because otherwise you can really get into some serious trouble. Of course, the most worrisome or concerning one would be unintended pregnancy. So it's really important to take them well and to understand what's going on. And
what do you suggest for patients if they miss a pill?
Okay. Well, first let's talk a little bit about pills. What I'd like to explain is how the birth control pill works. And I think a lot of times if you understand that, then it really helps in wanting to continue to take the pill or not. Birth control pills are hormones. So basically every day you take a pill, you're taking hormones which will suppress your ovaries. And so rather than having your ovaries make the hormones that we need, we're taking them in pill form. So the pills are suppressing the ovaries. And in doing so, we're eliminating a lot of issues like ovulation, which of course is how birth control pill works. So we don't ovulate, therefore we don't get pregnant. But with ovulation, a lot of other issues come up, ovarian cysts and pain. Also, we get a lot of women, young women. I have a lot of young patients who end up taking the birth control pill for acne, and also with ovulation and with your period, a lot of young women have severe pain. And so by suppressing the ovaries and making all of those functions go away, we're eliminating a lot of problems. And so birth control pills are used very, very often for non-contraceptive reasons. That's why we have girls as young as 13 sometimes on birth control pills. And I often joke with moms, I always say, I wish we'd call it something other than birth control pills, because, there's a connotation that moms in particular are really nervous about. So, therefore, if you skip a pill or if you forget to take a pill, unfortunately, you can have all of these other side effects that I talked about can happen. The most common is breakthrough spotting. And if you skip a pill or you forgot to take a pill, take it as soon as you remembered. You don't have to take it the next day. A lot of people may have this opinion, oh my gosh, I forgot to take it this morning. Well, I'll just take it tomorrow morning. Take it as soon as you remember. If the next day that you're supposed to take a pill and you look at your pack and you realize that you forgot yesterday's pill, then go ahead and take both of them, absolutely. But take the pill as soon as you remembered to take it. That's really important. There's no reason to wait till the next scheduled pill-taking time.
Would you suggest if you miss more than 2 pills that you also use a backup method for the month?
Absolutely. I think sometimes, depending on which time of the month you skip a pill, you should consider using a backup method, even with 1 pill. In the beginning of the pack is the most important time to remember to take every single pill, because if you forget to take the pills in the beginning of the pack, that's when you're more likely to have a breakthrough ovulatory cycle and get pregnant. And of course, for my young patients, I suggest they always use a condom anyway, because STD protection pills do not protect you from any sexually transmitted diseases. Very, very important to remember that.
Also, I believe that we get a lot of questions about breakthrough bleeding, and if that is normal to bleed other than your sugar.
Yes. Excuse me, especially when you start on birth control pills. It can take 3 to 6 months to regulate, to have some irregular spotting here and there, and that's very, very normal. And I think that's when the biggest failures of birth control pills happens in those first 3 to 6 months, because a lot of women say, I don't want to deal with this, and they stop, and they say, oh, I hate birth control pills, I'll never take them, etc. But if you really continue and stick with it, you will really see the benefits, because most likely you started on birth control pills because you were going to benefit from them. Right. So the idea of just always deciding it's not the right thing and dropping it is probably premature. So I really recommend waiting 3 to 6 months. And then if it's still spotting, consider a different pill. We have many, many options, and what works really well for some people doesn't work quite as well for others.
Is there any, we have a lot of concerns when a patient needs to take a vacation or has a function that they don't want to be on their period. Are you okay with women skipping their period?
Absolutely. Absolutely. And the way to do that is just to skip your sugar pills. You go straight to your next pack of pills and go ahead and keep taking them. The only problem with that is some women will have breakthrough spotting if they do that. Some women are not as good at doing, their bodies are not as good at prolonging the pill interval. But for most women, it works really, really well. So absolutely, you can go ahead and do that, and and not worry about it. And then just when you're ready to go, either finish the second pack of pills, or go ahead and stop them for 5 to 7 days, and then resume taking the pill again.
But always be prepared as well.
Absolutely.
Okay.
Always be prepared.
Some questions we get are about weight gain in the pill.
Very good question. That's good. I'm glad you remembered that. The pill has always been blamed for weight gain, and actually that's not true. The progestational agent in the pill sometimes can cause women to bloat. And so, yes, you may gain about a couple of pounds, maybe 3 to 5 pounds of water weight, and you might feel that that's made you gain weight. But the studies have shown 1 or 2, 6 months to 1 year out, the weight between a woman on the pill and not on the pill are exactly the same. And the other thing I tell my patients, sometimes progesterone makes you hungry, and so it's possible that you're eating more and that's what causes you to gain weight. But actually, most women I feel actually lose weight because they don't have those PMS cravings that they get when they're not on the pill. And so you got to take the good with the bad. Yes, you can have a little bit of bloating, but you do not have any significant weight gain with the pill.
So if you maintain your regular healthy diet, then you should be fine.
And exercise.
And exercise. Do you think, what is the concern with smoking?
This is really important. Unfortunately, smoking can really increase the potential risks of birth control pills. So we talked about the benefits of the birth control pill. Let's talk a little bit about the risks. The birth control, they're hormones, and unfortunately all the potential side effects associated with hormones we need to be concerned about. One of the biggest risk factors is forming a blood clot, and women with any genetic predisposition are at higher risk for forming a blood clot. And then when I say that, I mean a deep venous thrombosis in the leg, which can potentially shoot up to your heart and lungs, and those kind of things can kill you. It's very unusual to die from that because most women recognize symptoms before anything severe happens, but it's a real complication. So therefore, we always tell patients, first we ask if you have a genetic predisposition. Obviously, if they don't, then we're probably safe, but the risk still occurs. It still exists. It's very small, but it's still there. The other possibilities are strokes, and that can be due to the blood clot as well, but it could also be due to high blood pressure that can result from birth control pills. And smoking exacerbates all of these risks. So therefore, we do not give birth control pills to women over 35 who are still smoking. And if you can limit your cigarette smoking down to maybe 5 cigarettes a day, then obviously that's going to be safer than 10 or more cigarettes a day, but the risks are still significantly elevated, and therefore we strongly encourage women to not smoke and take birth control pills. But that's important to remember.
Is there any other significant negatives to the birth control pill? Or?
Some women claim, the one thing I've learned in doing this for a long time is that you can't clump everyone into a category. So, therefore, I have had patients who really just don't respond well to the pill. They just don't feel good on it. They just don't feel good with the synthetic hormones, and that's okay. So remember, nobody can tell you will feel good. This is the right thing. There are some instances where it may be the case, but you just may not feel good on it. And sometimes, by switching around, you could potentially find one that does work, and you feel adequate. You feel like yourself. But other women just claim they just don't feel like themselves on the pill, and that does happen. It's very rare, but it does happen. But outside of that, I can't really think of anything significant. How about you?
I don't think so. I think there's many options in the realm of birth control, not only the pill.
Right.
There's a fit for everyone.
Right. And I feel like if you fully understand what you're doing and why you're doing it, I think it's a really, really excellent form of contraception. In fact, I think it's probably the best form of contraception for young women because of the non-contraceptive benefits, some of which I've mentioned, but there are also a lot more of them that we can discuss with our individual patients.